We saw a lot of the intersectionality between mental health, AOD use, trauma, family violence, and homelessness, and the idea that no one organisation can solve or support people with all of their needs, and that you need to be working together.
Life has its twists and turns, and for women, gender and disadvantage intersect many times over their lifetimes. From the huge changes presented in relationships and starting a family, to the inevitable changes in health, such as menopause. Women are expected to take on more of the caregiving associated with raising children and taking care of elderly parents. And while this can be beautiful, it also has implications for women's earning capacity and access to housing. And then there is the all too common experience of gendered violence and the many ways it manifests. There are also the challenges of mental health and addiction. Whether or not people want to reflect on this part of the human experience, it can have devastating outcomes for individuals and their families. These challenges have profound implications, especially for women who are facing some kind of housing stress. I'm Dr. Kate Raynor, the Director of the Centre for Equitable Housing at Per Capita, and I have been researching Australian housing for over a decade. What could a gender equal housing system look like? How would we know it if we saw it? That's what we'll find out in Season 2 of Homes Not Houses. On this episode of Homes Not Houses, I'll be joined by Laura Mahoney, CEO of Windana, to unpack the changing life courses of women and how they affect the way they access safe, affordable housing. Laura Mahoney is the CEO of Windana, a not-for-profit whose purpose is to provide services across Victoria for adults and young people experiencing alcohol and other drug harms, family violence, mental health challenges, and social disadvantage. Before taking on this role, Laura was the Executive Director for Homelessness Solutions and Impact at Launch Housing. And she joins me now to share her insights into the key life events that impact women.
Thank you so much for your time, Laura. I just wanted to start with a question about you and what your own relationship with housing, homelessness, and gender is, and how you came to be working in this area.
Thanks, Kate. It's lovely to be here. I came into housing and homelessness over a long period of time. So I experienced homelessness and housing insecurity as a child and into my teenage years. And it was entirely based on how the outcomes were really terrible separation for my mum, and the fact that being a woman really impacted her options at that point in time. And so that's why I've always had a focus on the gendered nature of housing, community services, support provision, and how that can work. And most of my career has in some form been focused on ensuring that people have equitable access to services, and that those services and the infrastructure is all designed in a way that meets the needs of each individual person.
Yeah, I mean, we've discussed this before. It's interesting how many people in this sector have lived experience of housing insecurity and homelessness, and also gender-related housing experiences as well. So I think it's a common story.
Yeah, I think it is a common story, and it's one that sometimes you don't, when it's a childhood or young adult experience, it can sometimes take a while to formulate what that looks like in your career and the changes that you want to make, and also to understand the systemic issues that you can face as a result of that. And I keep thinking about things like the conversations that people have to have, standing in queues when you've got children to try and access different support programs, or being put on hold on phone calls just to access a service, and meanwhile you've got children in the background trying to get your attention, or that you need to look after, but you can't do that because the service wasn't designed for you or your needs. And it's a particularly relevant thing for women.
Yeah, absolutely. It's such an important thing to keep in mind. On the topic of your career, you have a brand new role. Do you want to tell me where you are now, what you're doing, and what's been going on in the last couple of months?
I do have a brand new role. About a month ago, I started as the new CEO of Windana, which is a community service organisation focused on supporting people with drug and alcohol concerns and other health concerns. So it's a really interesting space to be in, with a lot of cross-pollination with where I came from at Launch, in a homelessness and housing perspective. We saw a lot of the intersectionality between mental health, AOD use, trauma, family violence, and homelessness, and the idea that no one organisation can solve or support people with all of their needs, and that you need to be working together and collaboratively. And so for me, this is an opportunity to work in a more specific way, I guess, with some of the issues that people face the most stigma for, and really think about what it is that people need. What is it that people are trying to achieve with their lives, and what are some of the barriers for them to do that?
Yeah. And I mean alcohol and drug usage and mental health are some of the most stigmatized things that people can go through. Do you find that there is a gendered aspect to substance use and mental health, and both how it's experienced, but also the kinds of services or needs that people might have?
Yeah, I do. There absolutely is. Like many of our community service systems, the system was designed many, many years ago, predominantly focused on the client at the time, which was a male, usually. And I think there are still just as many women who need support and who need help in this area, but the stigma that they face is far more extreme in many ways. And the risk that some of them may have or may feel they have by accessing services is also considerable. It can affect people's housing, both the ability to get it and to keep it, and it can affect women's ability to keep their children if they're carers and if they disclose what's going on in their life. They can run really significant risks. Family violence is a crossover in all these areas as well. So you also have safety risks in many cases. And trauma is behind so much of it, which means thinking about that is really important.
Yeah, it feels like, based on what you're saying, there's a real double bind. I mean, for a parent of any gender, but this kind of butting up of, I want to keep my children safe, I want to keep my children with me, but also I need help. And if I ask for help, will I be deemed an unfit parent? And what are the repercussions of that? Do you see that kind of decision-making process play out at all?
Yeah, all the time. And it was similar to what I saw working in homelessness.
Yeah.
You know, it's really hard to say you need help for something that may be a trigger for a child protection report, for example, or that may raise questions about your ability to parent or to keep your housing, and also can impact some other aspects of your life, like whether or not you can work, whether or not you can make appointment times. Are services designed so that you have to present in person? And if you think about all the things that someone has to go in person for, you know, like going to see houses, going to get to see a GP, seeing just so many services I can't even think of. I can't name them all off my top of my head. But those sorts of things are real barriers to a lot of women, and particularly those with caring responsibilities, both children and older parents.
Yes, and as we know, those caring responsibilities disproportionately tend to sit with women. So yes, they're absolutely overlapping things. So we're talking about gender and homelessness and service systems, but to think about housing more broadly, what has gender got to do with housing? Do people of different genders have different experiences accessing homes and what they need in a home?
Yes, they do. As you and I know, we've spoken about this before. They absolutely do. Women have, depending on what their personal circumstances are at the time, can have very different needs for housing. For older women, housing is really difficult to access. A lot are on the pension. Quite a few no longer have superannuation. Often there's bad separation sitting behind women who are experiencing homelessness, job losses, any sort of house crisis. There are definite gendered aspects to the housing market and to the type of housing that you need, depending on what life stage you're in. In the mainstream, you don't expect to stay in one house for the rest of your life. You know, your different life stage will have a different impact. And particularly as a woman who may have caring responsibilities, who may be in and out of a relationship that could affect your financial standing, can have legal repercussions, it can really impact where you're going to live and how. If you've got children in your care, for example, you'll want to be near schools. You'll want to be near other services so you're not spending your entire time on the road. Childcare is really important if you're going to be working. And you'll need multi-bedroom housing. And that's not always what we build. And then often when we're thinking about intergenerational disadvantage, we're also then looking at women who may become carers for other nieces, nephews, family members, older parents, and therefore their housing needs to be more flexible than what you can access, say, off the housing register. You need to be able to have multiple bedrooms so that you can grow in place, or so that you can care for family members, because as you said before, we know that women do take on the bulk of the caring responsibilities. They take on part-time work, so that means you need to be able to access that work quite quickly without having to spend 2 hours each way traveling each day. So there's a lot of things that go into, which apply to many men as well, particularly men that are carers, but disproportionately affects women.
Yeah, absolutely. And I think it's really interesting, this discussion of larger homes, or at least homes with more flexible floor plans or more bedrooms, because the broader conversation about social housing and market rate housing at the moment is that we've got smaller households. And so we should be focusing on one bedroom apartments. We should be focusing on studios. And there's also this discussion that is always in social housing, which is lowest cost per unit. And I understand, because we have a wildly under-resourced social housing system. And so if you can get 10 units at one cost, or you can trade off and get 7 units at the same price, then you're probably going to choose the 10-unit option. But there's repercussions for that. Do you think our focus on one bedroom apartment is going to have implications in the future that's a problem for the social housing system?
Yeah, absolutely. And I think it's because we're focusing on the wrong measure. So we're focusing on the number of houses as opposed to the number of bedrooms or the number of people that we can house. And so if we're counting the number of bedrooms or the number of people, that 7 block of apartments may well actually be housing 12 people, whereas the 10 blocks of single bedroom apartments might just be housing 10 people. So therefore, it just depends a little bit what you measure as to whether or not you're thinking about what your return on investment is as the government.
Yeah, that's such an important reflection. And I think we also need to remember that people are complex with moving requirements over time. And even if you are on the register as a single person, you may have part-time caring responsibilities for a child, or you may have a parent come stay with you. You will kind of move in and out of different housing requirements over time. And if you don't have that flexibility, it's really constraining people's choices.
That's it. And it's something that I'm seeing even now. So through my work with Windana, what we've noticed is, in order for people to meet appointments or to attend some of the services that we offer, if they've got younger children, they need care. They might need their parent or an aunt to come and stay overnight and look after the kids, or to arrive early in the morning and drop them off to school. We try as much as possible to manage services within, for example, school drop-off times if we know that the biggest group of people have caring responsibilities. But that still means everything needs to be closely located. The idea of the 20-minute city is really important. But it's particularly important, I think, when we're looking at housing for women and its location close to services and close to all the things you need, so that you're not having to do multiple trips in multiple directions just to access the basic supports that you need to live a life.
Yeah, this has come up quite a bit on this podcast, this idea that generally men tend to travel point A to point B and then point B, point A, back home again. They have quite linear journeys and they have quite linear days, right? Home to work, work to home. Whereas women tend to go A to B to C to D, back to A, over to E, and there's lots shorter journeys, more trip chaining, more complex patterns of movement. And this tends to be why, when we talk about location and that 20-minute city, it pertains to men and women, but particularly to women. So it's good to hear it coming up again in the context of services.
Yeah. And I think the location of that really matters too. I've been talking to some of our residents who are in residential rehabilitation, for example. One of the biggest barriers for people leaving rehabilitation, because you're there for a period of time, is accessing housing. But also accessing housing in a location where they want to be, whether that's away from previous partners, a previous environment, wanting a better lifestyle for their children when they come out, access to schools. But that requires a lot of bureaucratic changing as well, like you're shifting regions, you're having to think a little bit differently about where your family and your support systems are. And then while you're trying to deal with one health issue, you're still also having to concurrently think about your housing when you leave, because we're working in the community sector. So we're not working with people that have the funds to be able to pay rent and rehabilitation and childcare costs and all of those things together. We have to be thinking about how our systems all work together to make sure that people do have the support that they need where they need that and when they need it. So if it's housing related to health and making sure that your support services are connected, it's really important.
Absolutely. And picking up on that question of health, I had a question about health generally, but I mean, we're talking about women's health, how women's health intersects with need for housing over a lifetime. And that could be mental health, it could be pregnancy, postpartum, menopause, endo, all those kinds of things. Like, how do you see health and housing intersect in your work?
A lot of ways. And I think there's two ways to look at it. So one is that flexible layout of our housing to allow private spaces. As our services evolve, and hopefully continue to evolve in ones that meet people where they are, there's the opportunity for more home-based services through telehealth, which has grown in all sectors, from mental health through to physical health. But to do that, you need to have a private space within your own home to be able to have those conversations. If you've got a partner and children at home, you need to be able to be confident that you can have that conversation either when they're not there or in privacy when everyone is home, so the children or the parents are being looked after. So there is something in the design of our housing that's really important if it's not going to be located close to services. But where it is, the number of women that can't access the health services that they need because they're only in designated locations or major cities, but that's not where the housing's being built, or the housing's not being built on a transport line that allows them to get there. If you think about Rosebud, which I know it's an area of focus from both a homelessness and a mental health and a health and all services situation, it's seen as being part of the Mornington Peninsula catchment, but it's 2 hours to get by public transport to get from Rosebud to Frankston or Cranbourne or somewhere where most of the services are. It's a 40-minute drive, but 2 hours on public transport. Like, if you're a woman trying to access specialist care for your endometriosis or specialist mental health support or postnatal support or children's services, that's a 2-hour trip if you don't have a car in both directions. That means you're probably more likely to forego getting that support and that health because the idea of even just accessing it would be overwhelming.
Yeah, that's another thing that's come up in these discussions, which is not necessarily gendered, although you can take a gendered lens to it, is that a lot of the new housing that we're building or the housing we're seeing that is affordable is in peri-urban areas on the outskirts of cities or master planned estates, things like that. And it's great because that is stock of homes that are affordable, and it's particularly exciting if you're a first home buyer that there's a place that you can buy, but it comes with all of these additional costs associated with accessing those services. And that geography of disadvantage is a really important part of the discussion.
Yeah, it really is. Not everyone will know this, but when I first started my career, I worked in youth work out around Broadmeadows, Epping, Thomastown, Craigieburn, Layla. But the longer I was out there, the more I realised that a lot of the issues the young people were facing was actually about access to services. So they were coming to the attention of the justice system for reasons that really, if our transport system and our service system had been better designed and the housing was co-located, probably wouldn't have come up. And so I went after that into planning to see if that we could design our cities better and think about where our housing and our services and our transport was located. And the plans are all great, but the implementation of them has not kept up. And now that I'm back in my first love, which is actually working with people, I see it even more so. We try to get services in Cranbourne, in Pakenham, in those growth areas, because there's nothing else out there. It's so limited. The waiting lists get longer and longer the further you get from the city because it's just not designed that way at the moment.
Yeah. Have we talked, you and I, about my favourite topic, which is the care blocks in Bogota?
I think so.
In Colombia? I don't know. I bring this up in every conversation.
You sure we have.
I'm really exciting at a dinner party. Let's talk about urban planning and care design.
I mean, it's what I do whenever I go to another country. Oh, how's this designed? Go to another city, go, oh, did this suburb work?
Yeah, I think we're nerdy in the same way. Yeah, Bogota in Colombia, they did this analysis that showed that the average woman in Bogota spent 8 hours a day in unpaid care work. Like, it was something insane. If you were a low-income woman, then your entire life was given over to care work. And a lot of that time was lost in transporting different family members and like really laborious things like hand washing clothes. And it just meant that there was no time to do any of the forms of education or self-care or any of those kinds of things. And so they've built these like massive clusters of care services in different parts of the city to resolve that exact issue. I just think it's such a great idea. And I also think that, like, from a social policy or urban planning perspective, we're so often pointing to the UK, to the US, to Europe, that anytime I'm like, oh, Latin America, let's get that example in there. Let's celebrate those wins. I think it's a great example of what you're talking about, of ways we could be responding to these things.
Yeah, and you can see the impact that it makes. We co-locate at the moment in Cranbourne, Frankston and Dandenong with a whole range of services. So you can have mental health services, legal services, homelessness services, and our AOD services all in one location, which means that people that are coming for support for one thing can access another thing, and they don't need to go somewhere else. So they're right there, and their families can as well. The children and family services are nearby. There's often a headspace in very close proximity. And I think that has worked really well. They are locations where commercial rent is a little cheaper than others. So that co-location is a bit easier. The buildings are a bit bigger. I know it's like really practical things, but important. Because to co-locate, you need the space so that all the services can be there. So you can have enough confidential rooms and family rooms and things like that. But it's particularly beneficial to women with caring responsibilities because it makes it so much easier to plan. They can get all the services that they need in one place. They can do the self-care if that's, part of what they need to do, as well as the practicality of finding housing, if that's the other part. And then still know exactly how long it will take to get back to the school or the childcare or the family member that's looking after their children. Or if they're a young person, they can get there after school and then, be home on their bus without a huge amount of disruption to the rest of their life.
Yeah, that's great. So we've kind of touched on that geography lens, but I'm interested in how gender and disadvantage intersect over a lifetime or across generations, that more like generational side of things. Do you see that happening in your work, that intergenerational disadvantage element?
All the time. All the time. It is incredibly hard to break out of a poverty cycle in the days that we have. And we know that trauma can impact the next generation in a really big way. So if you're not able to provide the support that people need and that their families need at that point in time, you're not really intervening in helping prevent the next generation from going through the same things or experiencing the same trauma. It really needs to be quite focused, and it changes over life stages, right? So when you're a young person, what you experience, what you see, and the support you get and you need is different to what you'll need if you're a young person who becomes a parent, or if you're in your middle age and you lose your job, or have a health crisis that impacts your ability to live, or you suddenly find yourself caring for children and elderly parents or any other family members at that point in time. Your support needs change, your housing needs change. You really need that community and village around you. So that I think it's not just the services that are provided, but it's the community that you're a part of too is really important, and probably not talked about enough, because that can be sometimes the one thing that can sustain you in a positive way as long as possible. But for some people, they need a new community at different life stages because maybe they're trying to change things or shift, the influences that have been in their life or in their children's life. But the intergenerational aspect is real. And I think as a community, we have a responsibility there because it's part of how society is broken down.
And have you seen good examples where that intergenerational disadvantage has been disrupted? And what does that look like? Can it be done?
Absolutely think that it can be done. It definitely can be done if we can invest enough services to support community. Because if we're talking about intergenerational disadvantage, we're talking about families. If we're working with parents, for example, on things that they want to change in their lives that may adversely affect their children, then we should also be working with the young people and the children in the family, because we know there is enough evidence now to show that trauma affects children at all ages. And we know that children, for example, with family violence, that children and young people are victims in their own right. So we need to be providing support to them so that everybody can move forward with their lives in the way that they want to at the same time, so that we're not perpetuating that loss and that disadvantage, and we're giving people the tools they need to be able to move on.
I've heard, this is not my area of expertise, but I'm interested in understanding. I've heard that there's been a shift recently in that historically children have really only been considered as children of a victim of family violence or like minors in the system, and there is increasingly a shift towards thinking about children as victims in their own right, or as having personhood and needs and services attached to them in their own right. Is that something you're seeing, and does that change the care models that are wrapped around them in ways?
Absolutely. And it's not just with family violence, it's with any form of trauma. Any form of trauma. I think, children who experience homelessness, they experience that in their own right, not just as the children of the leaseholder or the parent who is experiencing homelessness. Family violence, families where substances are being used in a harmful way, families where mental health conditions are, difficult to get support to help with. Those types of things, it affects the children. As if they can't get to school every day, for example, that's going to affect their long-term future as well. Those sorts of things do have an impact, and children need to be considered in their own right. But the services that need to be provided for children and young people are different to those for adults. They process things differently, their needs are different. And we need to be really cognizant of that fact when we are thinking about families, children, and intergenerational disadvantage.
Yeah, absolutely. So I have 2 questions I ask everyone at the end of my interviews. They're so fun, my little segment. So the first one is the vibing and venting, which is, what is one thing you're really vibing or excited about in gender and housing at the moment? And what is one thing you absolutely need to vent about?
So one thing that I'm really excited about is that people are talking about gender and housing, talking about the fact that we need a different system and that the needs are different, and recognizing that how women access housing and services is different. There is a gendered approach to it. I think the application of that might be a few years down the path, but at least the conversation is being had, and I'm excited about that. Venting, the venting part is that it's really hard to deliver different types of services and housing. So it's the flip side of that. Funding models are often really constrained, or they're based on systems that were designed many years ago. And you know me, I love a lot of evidence and making sure that we deliver what works. And so knowing that we have the flexibility both in houses, service delivery, and that ability to move to meet people's life stages and the challenges that they're facing at that point in time, I think is essential if we're going to really help people move on with the lives that they want to live in the way they want to live it. We have to do better at making sure that we're meeting people where they're at in the way that they want to be accessing services and support and housing.
Yes, agreed. And the final question is, if you could describe a genuinely gender equitable housing future, what would it look like? And how would we know it if we saw it?
I mean, can I be totally blue sky here? Like, I think if we were going to have a gender equitable housing future, it would be one where everybody is housed in the type of housing that works for them. So basically, we'd have no homelessness. We'd have services that were connected directly to the housing and around the housing, so that everyone can access what they need within their local community, supported by community connections in housing that works for them at that life stage. That is like my blue sky dream.
Yes. I mean, it's wild for me that we're having this conversation and you're like, blue sky. I know this is a crazy thought, but actually what you're saying is a housing system that works for everyone.
Yeah, a housing system that works for everyone and that's not dependent on anyone. Like, people who we work with now shouldn't be disadvantaged from accessing housing because of whatever it is that they're working through at that point in time, whether it's family violence, substance use, justice system engagement, whatever it is, they shouldn't be disadvantaged from accessing housing. It shouldn't have to be a factor in thinking about whether or not they can take the next stage in their life. Housing should just be there. It should be it's a fundamental human right, and it should not be playing into the conversation about the type of support that people need, right? It should just be there. But yeah, maybe that's my real vent. That my blue sky thinking is blue sky and not just reality.
Yep. I love that. What a great note to end on. I'm going to stop recording. Thank you so much, Laura. That was fantastic.
Next time on Homes Not Houses, I'll be joined by Jackie Galloway, OAM, CEO of the Peninsula Community Legal Centre, to take a look at the legal system and the role it plays in women's lives. This series is a production of Capita, the independent progressive think tank dedicated to fighting inequality in Australia. We work to build a new vision for Australia based on fairness, shared prosperity, community and social justice, and we are committed to providing ad-free and editorially independent content. This season is proudly sponsored by the YWCA and Australians Investing in Women, whose support helped produce the show and our research. Homes Not Houses was produced on the lands of the Wurundjeri-Woi Wurrung people of the Kulin Nation, and we pay our respects to the elders past and present.